I have a fertility center here, and every single day I am seeing girls with PCOS. And PCOS is something like, it's become every 5 to 10% of people or the population has PCO. And you understand what is PCOS and what is PCOD. So, when syndrome, when you have so many things combined, not only polycystic ovaries, that causes a syndrome. And all the girls or all the people who have not only this disease, of course, you know the long term complications: diabetes mellitus, endometrial cancer, psychogenic depression, and so on and so forth. You all are aware of that. So what do we do? The basic problem is insulin resistance. That means the body, the food that you eat, the insulin is not there to digest that food, and therefore fat or obesity happens, and so many other problems thereby as a repercussion of that. So, what do we do? Today, since we are talking only about nutrition, which will affect PCOS and subsequent fertility, it is so important for all of you who have this problem to understand that you have to keep an energy deficit of around 30% when you are doing a diet. That means at least 1200 to 1500 kilocalorie diet is the kind of diet that you should be having, because you want a weight loss of 5 to 10%. And these are the most recent guidelines, the ASHRAE guidelines, which tell us that at the moment you have a weight loss of 5 to 10%, the all the problems, that means your menstrual cycles become regular, your fertility issues become good, your acne, hirsutism, and all other issues also become much better. So 5 to 10% of weight loss is what you have to look at. And or what kind of diet you can take? It should be a balanced diet. It need not be a keto diet or a paleo diet or a vegan diet or any other diet. It should be a balanced diet, and it should be a consistent routine. That means don't skip meals and think that, okay, today I can binge, tomorrow I need not have anything. No, you should have a food which is rich in vitamins and antioxidants. And so, since we understand that the basic pathology is insulin resistant, therefore you also understand that the moment you take a diet which is very rich in food, then insulin will surge, and since there is resistance, the sugar will just become very high. So you don't have to do that. So you have to take a diet which is rich in proteins, but carbohydrates also. But which are the carbohydrates that you have to avoid? So you have to avoid breads, pasta, rice, cereals, all chips, cookies, candy, sugary drinks such as soda, juices. Don't take juice. You can eat a good fruit rather than have juice. All refined carbs, remember, whether it is white rice, whether it is white bread, are the ones which have high glycemic index. What does high glycemic index mean? A high glycemic index means your sugar is going to go very high, which is what you can't afford and you can't do it. So you have to take a high fiber but low sugar carbohydrates such as vegetables and fruits, and high fiber grains such as brown rice, quinoa, whole wheat pasta, oats. These are your high fiber grains. So if you want to make, say, a lunch, so you will put in say a handful of brown rice or quinoa or oats, and put a lot of veggies in it, so that it becomes a fiber rich good diet for you. What about potatoes, corn, peas? These are the kind of rich carbohydrates which you should try to avoid. You should avoid, don't in your breakfast think I can have cakes and bagels and donuts and pastries. No, these are not for you. Okay, so what you should eat is a diet which is full of nuts, beans, eggs, fish, chicken. Well, these are rich proteins. You can have fats which are healthy unsaturated fats like olive oil, canola oil, And what you should avoid: margarine and your very rich butters, mayonnaise, cheese, dressings, red meat. So people who are non-vegetarian, I would advise them to be on salmon or fish or lean meat like chicken, but avoid red meats, which are high in fats. Then what about vegetables? Well, take low glycemic index vegetables like carrots, broccoli, spinach, kale, zucchini, tomatoes. These are the vegetables that you can have in abundance. And what about the fruits? Well, apple, kiwi, grapes, oranges, berries, blueberries, plums, peaches. These are the fruits that you can have in abundance. So, all in all, I would say, as far as diet is concerned, take a balanced diet, a nutritious diet, which so your nuts can be in your diet, your proteins should be high, your fats should be unsaturated, and your carbs. I think the most restricted things are the carbs. So, the carbs you should always plan what kind of carbs you can take. You are no more free just to take as many alcohol, as many drinks as you can, because they're all rich in carbohydrates and all of them have a high glycemic index. So your diet should be something which is low glycemic index, lot of veggies, good amount of fruits, which are the right fruits for you, and a diet which will be fulfilling, satisfying, will increase your insulin or glucose slowly, which will not cause a spike of sugar rise, so that it is not only the disease itself is not only causing you obesity and increasing your waist hip ratio. It is also causing, it's a lot of low self-esteem I've seen in these girls, lot of psychological issues, a lot of depression, lot of sleep apnea, endometrial cancers, heart disease. Of course, diabetes, we all know, is a big issue with them. So I would only advise all these girls is keep a diet which is balanced. Secondly, be consistent with your exercise. It's very important, and all our medical algorithms now say at least 45 minutes to an hour of exercise is what you require, because a lot of the metabolic derangements that happen. Now, I also came across an article where there are some people like there are some herbs which also cause a lot of like fenugreek, methi dana. It's extract called furocyst. It comes in in capsules, and if you take two capsules every day, so fenugreek or methi is one. Then you have cinnamon. uh, that also decreases the free radicals in the body and decreases the fasting glucose. So if you take 1.5 grams of cinnamon every day, your green teas, so your cinnamon tea, green tea, all these will also boost by increasing your metabolism and increasing. So vitamin D is very, very important that you keep your vitamin D in place, especially as you want your fertility to be boosted. Omega 3 fatty acids, it's important to have that. There is a substance called inositols in our body, which is myoinositol and decyoinositol, and the ratio is around 40 is to 1. And previously, we used to have a lot of metformin. Now inositols have taken over, and they are present in the fruits, in the beans, in the grains, in the nuts. So that's why these should be more in your diet. They keep your sugar in check. Remember that this is a chronic. It causes chronic inflammation. Not only that inflammatory, it increases the oxidative. There is a lot of reactive oxygen species, and PCOS has got both genetic and environmental issues. So it is not that you can only blame genes, but it's the environment itself also which causes this problem, and therefore this issue should be resolved not only with a gynecologist, an endocrinologist, a dermatologist, a psychologist, and a nutritionist all together. So I think with that I would say that uh, you look after yourself and your PCO problem much better in a nutritional manner rather than go to doctor and start taking medical. Okay, so that is as far as I am concerned. Now, coming to the questions. So, uh, does the couple fertility always depend only on women? No, not at all. Remember, fertility is depends both on man and woman because it is both the egg and the sperm. And if sometimes one partner is weak while the other is strong, so if suppose your egg is weak and if the sperm is strong, it can overcome. It's like a couple. So if both of them are strong, great. If one is weak, if the other is strong, that also will work wonders. So I think, especially with fertility issues, it is important. So Nisha is asking, how can I boost my fertility? So as I said, especially girls with PCO, please don't delay your fertility too much, because most of the time these girls are on oral contraceptive pills and therefore the fertility they keep delaying. So it is important, if you're married and within 2 years, if you're well settled, then go ahead and plan your fertility. Secondly, so yes, Sunaina is asking, do we really need to take care of the diet now that she's 32 years old? Yes, it's extremely important to take care of the diet as far as fertility is concerned, because she's 32. Her eggs are smaller. There are a lot of numbers of eggs, but none of them are mature enough. So it's really important that she takes care of herself, her diet, and not only takes a balanced diet, but goes out for that 1 hour walk, keep her weight in check. I think I can't emphasize more that the weight is the most important issue that you have to address, and keep the weight in check, keep the diet proper, you know. And the other question is, boy and girl both. Yes, of course, both. See, it goes without saying that both the man and the woman have to take care of their diet. Today, because we are talking of polycystic ovary, so we are talking of the girls, who have this problem, and the girls can only take care by taking. Women are the ones who neglect their diet. They would, give it to everybody else, but not take it themselves. Even if I've seen for my patients, nuts, they will give it to the kids but not eat themselves. So it is very important that you take your diet very seriously. Preeti is asking, I'm suffering from do I have PCOS and do I need to recover it through diet or medicine are also important. Well, see, when you are young, you can do a diet, but when you are trying fertility and you may require addition of some small substances. Metformin is one of them, and metformin keeps the sugar in check, and you have to take it long term. So metformin and myoinositol, decioinositol combination. So the inositols, which are now come also in a big manner. So these two medications are there for you. Sometimes the doctors put you on oral contraceptive pills so that your cycles are regulated. But remember, when you're trying fertility, you've been on pills for very long. It may take a little while for your cycles to rebound and bounce back, which will happen. So give a 2, 3, 4 months or 6 months of detox, and then you try for fertility. And as I said, fertility is an issue which is both male and female are part of it. To see to it that both of you, it'll be great if the husband or the partner can also take care of his wife through diet by following the same diet. Okay, Uma says, Doctor, I'm 42 years old now and it's been 3 months. I'm not getting periods. It is because of unhealthy diet. Well, as a 42-year-old woman, I would say premature ovarian failure, or she may be perimenopausal for all we know. Although Indian women have 45 years is the median age, 45 to 52 years, but not getting periods because of unhealthy diet, I won't know. I would really like you to go and check out with a gynecologist, look at your ultrasound, see whether you're pregnant or not pregnant and what is happening inside the body. Okay, Lakshmi is saying, what precautions should I take if I'm pregnant with PCOS? Excellent question, Lakshmi, because just becoming pregnant doesn't finish your problem. You have to carry the pregnancy to term. It is normally seen that women with PCOS miscarry, they do have abortions, they have intrauterine growth retardation, they have gestational diabetes mellitus, they have pregnancy induced hypertension, and therefore all these problems are going to compound, especially with PCOS. So you again keeping the diet in place so that it doesn't cause problems as far as PCOS is concerned is going to be very, very important. So remember that first getting pregnant is difficult, but if you do get pregnant, then pregnancies also have their own issues. So it is important that you be on a diet which is balanced, nutritious, and adds on to the health of the baby and looks after you also. So a lot of water to be taken, lot of green leafy vegetables, spinach, kale, carrot, all these vegetables should be included in your diet, and then go ahead. So Archana is asking, how long should my partner and I try to conceive before seeking help? Well, if you are young, that means less than 35, then 1 year of trying is enough. You've been together for 1 year, if you're not conceived, then go to a doctor. If you're more than 35, then 6 months is enough for you to try. And if you have not got pregnant by that time, then again it is time for you to go to a doctor. So I think we've answered most of the questions which were here. I, Dr. Rita Bakshi, I have a center called Riza IVF, International Fertility Center in Green Park, Delhi, and we are really working on, making this platform, making this uh, earth healthier. And I always tell girls to become aware of their adolescence, to become aware of their own health, take it in their own hands, and just don't binge on junk food, burgers, colas, pizzas is what the food that I'm seeing these people take. Take a healthy diet, check your vitamin Ds, take your capsules of vitamin B complex, live a healthy diet, exercise at least an hour a day, and keep your weight in check. Whenever you become overweight and your cycles are going awry, it's important then you keep your weight back in check. Otherwise, you'll have hirsutism. You not only have hair on your face, you lose all your hair on the right places, and so a lot of androgen symptoms will be there. So my advice to all of you will be, and the message that I would like all the people who are suffering from PCOS is that keep your weight in check, have a balanced diet, and uh, do not let your fertility clock tick away too long, because uh, you may require a little bit of help. I'm not saying everybody does that, but if you have not conceived in a year or so after being together with a partner, then it's high time you look at a doctor. You don't want your eggs to rot away, by the time you think that that is the right time. And all the people who are trying not to conceive right now and who have a modeling career or a career which is, going high, then I would also ask you to preserve your eggs, do a cryopreservation of your eggs so that whenever you require at the right time, you will have enough eggs, enough of your own genetic material stored away, and you can have a baby of your own. So, thank you so much, the audience. And Baby Chakra for giving me this platform to talk to you, to talk to the audience. And I thank each and everyone who checked in today with me.